a project investigating how young people view themselves when they're depressed. What did the project do?
We all know our view of ourselves can include strengths and weaknesses, what's important to us, and how we think society views us. But we were interested in how these things might change when we're depressed. To find out more, we talked to experts, groups of young people, mental health professionals, and researchers. We also read research studies that looked at how young people view themselves when they're feeling depressed.
What did your project find?
The research studies and our expert advisors gave us lots of useful insights, and these can be nicely summarised in 3 parts.
Do young people view themselves differently when they are depressed?
We found that depressed young people tend to describe themselves more negatively and less positively compared to young people who aren't depressed.
When you're really low, from my experiences, I always see the weaknesses in myself and I never really see the strengths.
Young people also often compare themselves to others and worry what other people think about them.
Why do young people view themselves differently when they're depressed?
A lot of changes occur during teenage years. It's when young people first start to develop their sense of identity. Their thinking can change, and so can the things that are important to them. Depression is characterised by a range of negative thoughts, and for some young people this can include negative thoughts about themselves.
Self-evaluation doesn't exist in its own right within that individual. It seems to be shaped by individuals around us.
Can we change how young people view themselves when they're depressed?
How young people view themselves could be targeted through talking therapies such as counselling, or through the use of specific techniques such as creative writing or drawing. Having a strong and trusting relationship with a therapist is also important. The evidence suggests that young people's view of self can improve with treatment, but it's important to approach it with caution. It's really common and normal for young people to view themselves more negatively and less positively if they're feeling depressed. If you're worried, talk to someone, friends, family, or a professional. It's also really clear that a lot more work needs to be done to improve treatments and how they target this.